Welcome to our presentation on the indicators of health. Understanding how we measure and track public health is critical to improving outcomes worldwide. Today, we will explore the key metrics used to evaluate well-being and healthcare delivery. In this session, we will cover the core criteria of a good health indicator and examine essential metrics like morbidity and mortality. We will also dive into advanced measures such as Daily, CALE, and HALE, before wrapping up with healthcare delivery indicators. By the end of our discussion today, you will have a clear understanding of what defines a health indicator. You will also be familiar with their primary types and know exactly how they are used in real-world health systems. Before we can measure health, we must define it. The World Health Organization defines health as a complete state of physical, mental, and social well-being, rather than simply the absence of disease. This holistic definition requires comprehensive measurement tools. Just as a fuel gauge tells you how much gas is left in your tank, we need indicators to tell us the status of public health. Without these tools, we would be operating in the dark without any way to track progress or identify needs. Health indicators are essential tools that allow us to measure, monitor, and compare population health. By highlighting specific needs, they help decision-makers allocate resources effectively, guide policy, and ultimately evaluate the success of our interventions. In practice, these indicators serve several key functions, from describing and comparing the health of different communities to identifying urgent needs. They are also crucial for evaluating health services and planning how to distribute limited medical resources. To make sense of all this data, we classify health indicators into several distinct categories. These range from mortality and morbidity rates to environmental, socioeconomic, and quality of life measures, ensuring we capture every dimension of a population's well-being. Crude death rate represents the number of deaths per 1,000 people annually, but it is heavily influenced by a population's demographic structure. Life expectancy, on the other hand, measures the average remaining years of life, which is projected to reach 72.5 years in India by 2025. The infant mortality rate is a highly sensitive metric reflecting not just infant health, but the overall socio-economic conditions and healthcare effectiveness of a community. Notably, India's infant mortality rate declined to a record low of 25 deaths per 1,000 live births in 2023. Morbidity indicators help us understand the burden of ill health through two key measures: incidence and prevalence. While incidence tracks the number of new disease cases within a specific time frame, prevalence measures the total proportion of individuals living with the condition at a given point. To better understand population health, we use the Sullivan Index to calculate disability-free life expectancy. By subtracting years lived with disability from total life expectancy, this index provides a single, comprehensive measure of both the quantity and quality of life. Healthy life expectancy, or HALE, estimates the average number of years a person can expect to live in full health. Globally, this figure reached nearly 62 years by 2021, though outstanding progress in nations like Japan and Singapore shows the massive impact of diet and lifestyle. Disability-adjusted life years, or DALYs, allow us to measure the total burden of disease on a population. By combining the years of life lost to premature death with the years lived with a disability, we can see exactly how much healthy life is being lost. DALYs are invaluable for health policy and planning because they help us allocate resources to the areas of greatest need. By identifying disadvantaged groups and measuring the results of interventions, we can compare health statuses globally and target our programs much more effectively. Finally, quality-adjusted life years, or QALYs, help us evaluate the cost-effectiveness of specific medical treatments. This metric scores a year of perfect health as a 1, down to 0 for death, estimating the years of high-quality life added by a successful medical intervention. Nutritional status is a powerful, positive health indicator. For newborns, we assess maternal nutrition by measuring birth weight, length, and head circumference. In preschool children, measurements like weight help detect acute malnutrition, while height and mid-arm circumference point to chronic nutritional challenges. To standardize these indicators internationally, we look at deviations from the WHO Child Growth Standards. Children fall into categories like underweight, stunted, or wasted if their measurements are more than 2 standard deviations below the median. Conversely, being more than 2 standard deviations above indicates overweight. Growth monitoring for children involves tracking physical dimensions over time, such as weight, height, and head circumference. For adults, nutritional status is evaluated using different parameters. In this population, indicators like underweight, obesity, and anemia serve as key measures of overall health. Health extends beyond the physical, requiring us to monitor social and mental well-being. Rates of suicide, substance abuse, and domestic violence are critical indicators that guide targeted social interventions. For children, these factors are deeply tied to parental stability and family support. Environmental indicators reflect the quality of the physical and biological surroundings in which we live. The most critical measures are access to safe drinking water and basic sanitation, which heavily impact communicable disease rates. Other vital indicators include levels of air and water pollution, radiation, and toxic exposure. While socioeconomic factors do not directly measure physical health, they are vital for interpreting broader health trends. Key metrics include population growth rates, per capita gross national income, and the dependency ratio. These figures help us understand the economic capacity of a population to support its members. Other essential socioeconomic indicators include literacy rates, housing density, and per capita calorie availability. Across the globe, there is a clear correlation between favorable socioeconomic conditions and better health outcomes. Essentially, stronger social foundations lead directly to fewer community health struggles. Finally, health policy indicators reflect a government's political commitment to its citizens. The most telling measure is how resources are allocated, specifically the proportion of gross national product spent on health services and environmental sanitation. Prioritizing resources for primary care is key to sustainable public health. To truly measure societal progress, we must look beyond basic life expectancy to the physical quality of life index. This composite index averages infant mortality, life expectancy at age 1, and literacy on a scale of 0 to 100, offering a view of well-being that completely excludes economic factors like GNP. Another vital metric is the Human Development Index, which evaluates longevity, education, and gross national income per capita. Ranging from 0 to 1, it provides a comprehensive snapshot of global progress, where countries like India have historically been tracked to measure development gains. Adopted by the United Nations in the year 2000, the Millennium Development Goals established a unified framework for improving global health and welfare. These 8 core goals are supported by 21 quantifiable targets and 60 distinct indicators to track international progress. Key priorities within these goals include reducing child mortality, improving maternal health, and combating major diseases like HIV, malaria, and tuberculosis. By focusing on targeted indicators such as immunization rates and maternal care, nations can systematically address the most critical public health challenges. For your assignment, please review these key concepts, focusing on how we define and apply different health indicators. Make sure you understand the differences between morbidity and mortality measures, as well as specialized metrics like DAILYs, CALES, and HALES. Thank you all for your time and active participation today. I wish you the best of luck with your assignments, and please feel free to reach out if you have any questions.